Medical assistant exam administrative questions. Question 1. While working in a primary care office, a patient is scheduled for an electrocardiogram and asks whether it will shock them. Which response is accurate? Option A. The test records electrical activity and does not deliver a shock. Option B. The electrodes inject medication. Option C. The test shocks every patient to start the heart. Option D. The machine draws blood through the wires. The correct answer is option A. The test records electrical activity and does not deliver a shock. A standard electrocardiogram is a recording test, not a treatment shock. Electrodes record signals and do not inject medication. A standard electrocardiogram does not deliver electrical therapy. Electrocardiogram leads do not collect blood. Question 2. While working in a certification exam scenario, the pancreas is discussed during patient education. Which hormone is associated with blood glucose regulation? Option A. Estrogen. Option B. Melatonin. Option C. Thyroxine. Option D. Insulin. The correct answer is option D. Insulin. Insulin is produced by pancreatic beta cells and helps regulate blood glucose. Estrogen is a reproductive hormone and is not the main pancreatic glucose hormone. Melatonin is associated with sleep-wake cycles. Thyroxine is a thyroid hormone involved in metabolism. Question 3. After reviewing the situation in a quality control review, a provider orders spirometry in the office. Which patient action is required? Option A. Follow instructions for a strong, complete breathing maneuver. Option B. Remove the mouthpiece before starting. Option C. Talk continuously during the maneuver. Option D. Hold both nostrils and refuse to exhale. The correct answer is option A. Follow instructions for a strong, complete breathing maneuver. Spirometry requires patient effort and correct technique to produce useful results. The mouthpiece is needed to measure airflow. Talking interferes with airflow measurement. The test depends on controlled breathing through the device. Question 4. In a family practice clinic, the office wants to place 2 short follow-up visits in the same time slot according to policy. Which scheduling method is being used? Option A. Open hours. Option B. Clustering. Option C. Wave scheduling. Option D. Double booking. The correct answer is option D. Double booking. Double booking places more than one patient in the same appointment slot. Open hours allow patients to arrive without exact appointment times. Clustering groups similar types of appointments together. Wave scheduling schedules several patients to arrive at the beginning of a block. Question 5. A medical assistant is working in an urgent care office when an electronic record uses an audit trail. What is its purpose? Option A. Track who accessed or changed information. Option B. Approve insurance claims instantly. Option C. Measure blood pressure. Option D. Sterilize instruments automatically. The correct answer is option A. Track who accessed or changed information. Audit trails support accountability by recording user activity in the record. Payer claims processing is separate from record audit logs. Vital sign measurement requires clinical equipment and technique. Audit trails do not process instruments. Question 6. During a telephone triage workflow, a waved glucose meter control result is outside the acceptable range. Which action is required before patient testing? Option A. Resolve the quality control problem according to protocol. Option B. Use the meter because patient samples are different. Option C. Record patient results without documenting controls. Option D. Change the patient's diagnosis to match the meter. The correct answer is option A. Resolve the quality control problem according to protocol. Out-of-range controls mean the system may not be reliable for patient results. Failed controls must be addressed before reporting patient values. Quality control documentation is part of reliable testing. Medical assistants do not diagnose and should not alter clinical information to fit a device. Question 7. While working in a primary care office, a claim requires the code that explains why a service was performed. Which code set is used? Option A. ICD-10-CM. Option B. CPT. Option C. Place of service only. Option D. NDC only. The correct answer is option A. ICD-10-CM. ICD-10-CM codes report diagnoses and reasons for services. CPT codes report procedures and services rather than diagnoses. Place of service identifies setting. not the medical reason for care. National drug codes identify medications and do not describe diagnoses. Question 8. Following office protocol in a community health clinic, a specimen must be protected from light after collection. Which handling method is appropriate? Option A. Leave the specimen uncovered at the front desk. Option B. Place the tube in direct sunlight to warm it. Option C. Wrap the specimen in foil or use an amber container as directed. Option D. Shake the specimen vigorously for 1 minute. The correct answer is option C. Wrap the specimen in foil or use an amber container as directed. Some analytes are light sensitive and require protection immediately after collection. Delayed or improper handling can compromise results. Sunlight can degrade light-sensitive specimens. Vigorous shaking can hemolyze blood specimens. Question 9. A medical assistant is working in a pediatric clinic when the assistant is reviewing the function of red blood cells. Which role is most accurate? Option A. Produce bile. Option B. Transport oxygen. Option C. Filter lymph. Option D. Create antibodies as their main role. The correct answer is option B. Transport oxygen. Red blood cells contain hemoglobin, which carries oxygen to tissues. Bile is produced by the liver and stored in the gallbladder. Lymph nodes filter lymph rather than red blood cells producing this function. Antibody production is associated with certain white blood cells and plasma cells. Question 10. For a patient encounter in an internal medicine office, the provider mentions the largest artery in the body. Which vessel is being described? Option A. Pulmonary vein. Option B. Carotid vein. Option C. Aorta. Option D. Vena cava. The correct answer is option C. Aorta. The aorta is the main artery carrying blood from the left ventricle to systemic circulation. Pulmonary veins return blood from the lungs to the heart. Carotid structures are in the neck, but the carotid artery is not the largest artery. The vena cava is a large vein returning blood to the heart. Question 11. While working in a medication administration visit, the provider requests an adult radial pulse during intake. Which technique should the medical assistant use? Option A. Place the stethoscope over the abdomen. Option B. Place 2 or 3 fingers over the radial artery at the wrist. Option C. Count respirations before locating the pulse. Option D. Use the thumb to feel the pulse. The correct answer is option B. Place 2 or 3 fingers over the radial artery at the wrist. The radial artery at the thumb side of the wrist is commonly used for an adult pulse. The abdomen is not used for a routine radial pulse. Respirations are measured separately and do not identify the pulse site. The thumb has its own pulse and can interfere with accurate counting. Question 12. While working in a women's health clinic, a patient is learning how to use a home blood pressure log. Which instruction improves reliability? Option A. Use another person's readings if the cuff is shared. Option B. Record readings with date, time, and relevant notes as directed. Option C. Skip technique instructions because home cuffs are automatic. Option D. Write only the highest number ever measured. The correct answer is option B. Record readings with date, time, and relevant notes as directed. A structured log helps the provider compare readings and context over time. Readings must belong to the patient. Proper positioning and technique still matter with automatic cuffs. Selective recording can mislead clinical decisions. Question 13. During a treatment room, the prefix hypo appears in a term such as hypoglycemia. Which meaning is correct? Option A. Before. Option B. Below normal or deficient. Option C. Above normal. Option D. Against. The correct answer is option B. Below normal or deficient. Hypo means below normal or deficient, as in low blood glucose. Before is indicated by pre. Above normal is indicated by hyper. Against is indicated by anti. Question 14. For a patient encounter in a walk-in clinic, a voicemail must be left for a patient according to office policy. Which message is safest? Option A. Demand payment details with full medical history. Option B. Leave another patient's results for comparison. Option C. Leave limited information and a callback number. Option D. Describe the diagnosis in detail on the message. The correct answer is option C. Leave limited information and a callback number. Limited voicemail content reduces the risk of exposing health information to others. Excessive information violates privacy and may not be necessary. Sharing another patient's information is a privacy breach. Detailed clinical information may be heard by unauthorized people. Question 15. To protect safety in a primary care office, a provider documents a vaccine administration. Which coding information may be needed for billing? Option A. Only the assistant's initials with no service information. Option B. Procedure code and diagnosis or reason for the service. Option C. Only the patient's favorite color. Option D. Only the room number. The correct answer is option B. Procedure code and diagnosis or reason for the service. Claims often require a service code and a diagnosis or reason to support medical necessity. Initials alone do not provide billing codes or medical necessity. Personal preferences do not support claim coding. Room numbers do not describe the service or diagnosis. Question 16. As part of exam preparation in a same-day appointment, the term nephrology appears in a referral. Which specialty is involved? Option A. Kidneys. Option B. Eyes. Option C. Ears. Option D. Bones. The correct answer is option A. Kidneys. Nephrology is the specialty focused on kidney function and disease. Ophthalmology focuses on eyes. Otolaryngology focuses on ear, nose, and throat conditions. Orthopedics focuses on the musculoskeletal system. Question 17. As part of exam preparation in a diagnostic testing area, a patient collapses in the hallway and is unresponsive. Which action should be taken first? Option A. Move the patient to a chair before assessing. Option B. Finish documenting the previous visit. Option C. Offer water by mouth immediately. Option D. Activate emergency response and assess breathing according to training. The correct answer is option D. Activate emergency response and assess breathing according to training. An unresponsive patient requires immediate emergency response and basic life support actions within training. Unnecessary movement can cause injury and delay assessment. Documentation should not delay emergency care. Giving oral fluids to an unresponsive patient risks aspiration. Question 18. A medical assistant is working in a preventive care visit when a patient pays a fixed amount at the time of an office visit. Which insurance term applies? Option A. Premium. Option B. Adjustment. Option C. Deductible. Option D. Copayment. The correct answer is option D. Copayment. A copayment is a fixed amount the patient pays for a covered service. A premium is the amount paid to maintain insurance coverage. An adjustment changes the billed amount based on contracts or corrections. A deductible is the amount the patient pays before insurance begins paying according to the plan. Question 19. Following office protocol in a diagnostic testing area, an insurance plan requires approval before a specialist visit. Which process is being described? Option A. Prior authorization or referral process. Option B. Autoclaving. Option C. Auscultation. Option D. Venipuncture. The correct answer is option A. Prior authorization or referral process. Some plans require authorization or referral before certain services are covered. Autoclaving sterilizes instruments and is unrelated to payer approval. Auscultation is listening to body sounds and does not approve visits. Venipuncture is blood collection and does not authorize insurance coverage. Question 20. To protect safety in an internal medicine office, a sterile package is torn before a minor procedure. Which action is required? Option A. Consider the contents contaminated and obtain a new sterile package. Option B. Tape the wrapper and use the contents. Option C. Spray the package with disinfectant. Option D. Use the items if they look clean. The correct answer is option A. Consider the contents contaminated and obtain a new sterile package. A torn wrapper breaks the sterile barrier, so the contents cannot be considered sterile. Taping does not restore sterility after the barrier is compromised. Surface disinfectant cannot sterilize items inside a compromised package. Clean appearance does not prove sterility. Question 21. While working in a same-day appointment, a provider orders a capillary blood glucose test. Which site preparation is important? Option A. Clean and dry the puncture site according to protocol. Option B. Use the first visibly dirty drop for every test. Option C. Skip patient identification because the test is quick. Option D. Puncture through visible dirt. The correct answer is option A. Clean and dry the puncture site according to protocol. Cleaning and drying the site reduces contamination and supports accurate capillary testing. Site contaminants can affect the first drop depending on protocol. Patient identification is required even for quick point-of-care tests. Contamination can affect the sample and infection risk. Question 22. While working in an internal medicine office, soap and water are required instead of alcohol sanitizer after caring for a patient with suspected Clostridioides difficile. Which reason explains this requirement? Option A. Alcohol sanitizer is always illegal in clinics. Option B. Hand washing is needed only before eating. Option C. Soap and water help remove spores more effectively from the hands. Option D. Gloves completely replace hand hygiene. The correct answer is option C. Soap and water help remove spores more effectively from the hands. Certain spores are not reliably eliminated by alcohol-based hand rubs, so mechanical washing is important. Alcohol-based hand rubs are appropriate for many routine situations. Hand hygiene is required at multiple points in patient care. Gloves reduce exposure but do not replace hand hygiene after removal. Question 23. At the start of care in a diagnostic testing area, a patient receives a document explaining what the insurer paid and what may be owed. Which document is this? Option A. Explanation of benefits. Option B. Progress note. Option C. Advance directive. Option D. Sterilization log. The correct answer is option A. Explanation of benefits. An explanation of benefits summarizes payer processing, allowed amounts, payments, and patient responsibility. A progress note documents clinical care, not insurance payment decisions. An advance directive communicates future care wishes, not payment information. A sterilization log tracks instrument processing, not claim payment. Question 24. When a patient encounter unfolds in an administrative check-in area, an adult patient has a blood pressure reading much higher than previous visits. Which action should the medical assistant take? Option A. Send the patient home to rest without notifying anyone. Option B. Erase the value because it may worry the patient. Option C. Tell the patient that hypertension has been diagnosed. Option D. Recheck using proper technique and report the finding according to protocol. The correct answer is option D. Recheck using proper technique and report the finding according to protocol. Unexpected or significantly abnormal vital signs should be verified and communicated to the provider. Abnormal readings require appropriate follow-up rather than dismissal. Accurate documentation is required even when the value is abnormal. Medical assistants do not diagnose conditions based on one reading. Question 25. An office review in a certification exam scenario shows that the term hypertension appears in the problem list. Which meaning is correct? Option A. Slow breathing. Option B. High blood pressure. Option C. Joint inflammation. Option D. Low blood glucose. The correct answer is option B. High blood pressure. Hypertension means blood pressure above the normal range or treatment threshold identified by the provider. Slow breathing is bradypnea. Joint inflammation is arthritis. Low blood glucose is hypoglycemia. Question 26. When a patient encounter unfolds in a clinical skills review, the assistant documents a patient's statement in the medical record. Which entry is most appropriate? Option A. No documentation is needed for symptoms. Option B. Patient is definitely exaggerating the cough. Option C. Patient states, I have had a cough for 3 days. Option D. The assistant diagnoses pneumonia. The correct answer is option C. Patient states, I have had a cough for 3 days. Quoting or clearly attributing patient statements helps distinguish subjective information from clinical findings. Symptoms are relevant to the visit and should be documented according to policy. Judgmental wording is inappropriate and not objective. Diagnosis belongs to the provider. Question 27. An office review in a quality control review shows that a patient states that the listed pharmacy is no longer used. Which action best supports accurate care coordination? Option A. Update the preferred pharmacy after verifying the new information. Option B. Choose the pharmacy closest to the clinic. Option C. Delete all pharmacy information from the record. Option D. Leave the old pharmacy because it is already in the chart. The correct answer is option A. Update the preferred pharmacy after verifying the new information. Current pharmacy information helps prescriptions and refills reach the correct location. The preferred pharmacy should come from the patient rather than staff convenience. Removing needed information can interrupt prescribing workflows. Outdated demographic information can delay medication access. Question 28. Before the visit continues in an exam room, a mistake is found in an electronic progress note after it was signed. Which correction method is appropriate? Option A. Ask a coworker to change it under their login. Option B. Make an addendum according to office policy. Option C. Delete the original note completely. Option D. Ignore the error even if it affects care. The correct answer is option B. Make an addendum according to office policy. An addendum preserves the original entry while documenting the correction transparently. Using another person's login violates accountability. Deleting a signed record can destroy the audit trail. Clinically important errors should be corrected through proper procedures. Question 29. Before the visit continues in a walk-in clinic, the urinary system is reviewed with a student. Which organ filters blood to form urine? Option A. Appendix. Option B. Spleen. Option C. Kidney. Option D. Gallbladder. The correct answer is option C. Kidney. The kidneys filter blood, regulate fluid balance, and form urine. The appendix is associated with lymphoid tissue in the digestive tract. The spleen filters blood cells and supports immune function but does not form urine. The gallbladder stores bile and does not form urine. Question 30. The care team in a clinical skills review asks for guidance because a new patient calls to schedule an annual physical. Which information should be collected for registration? Option A. The assistant's diagnosis before the visit. Option B. Only the patient's favorite pharmacy color. Option C. Demographics, contact information, insurance information, and reason for visit. Option D. Another patient's insurance card. The correct answer is option C. Demographics, contact information, insurance information, and reason for visit. Complete registration information supports scheduling, billing, and clinical preparation. The assistant should not diagnose during scheduling. That information does not complete registration. Insurance information must belong to the patient being registered. Question 31. For a patient encounter in a patient education session, an adult patient declines a procedure after the provider explains the risks and benefits. Which principle is being respected? Option A. Abandonment. Option B. Beneficence. Option C. Respondeat superior. Option D. Patient autonomy. The correct answer is option D. Patient autonomy. Autonomy means a competent patient has the right to make informed decisions about care. Abandonment involves ending care without proper notice or support. Beneficence means acting for the patient's good but does not override a competent refusal. Respondeat superior concerns employer responsibility for employee actions. Question 32. A medical assistant is working in a certification exam scenario when a patient has confirmed influenza and is coughing in the waiting room. Which infection control step is most appropriate? Option A. Apply droplet precautions and offer a mask according to protocol. Option B. Skip precautions if the patient is already taking medication. Option C. Place the patient beside an immunocompromised patient. Option D. Use only sterile gloves without a mask. The correct answer is option A. Apply droplet precautions and offer a mask according to protocol. Influenza is commonly managed with droplet precautions and source control measures. Treatment does not remove the need for appropriate precautions. Separating symptomatic patients helps reduce transmission risk. Sterile gloves do not protect mucous membranes from respiratory droplets. Question 33. An office review in a pediatric clinic shows that a patient asks the medical assistant to interpret laboratory results. Which response is within scope? Option A. Post the result publicly so others can comment. Option B. Change the results so it appears normal. Option C. Diagnose the patient based on abnormal values. Option D. Tell the patient the provider will review and explain the results. The correct answer is option D. Tell the patient the provider will review and explain the results. Interpreting results and giving diagnostic meaning are provider responsibilities. Public disclosure violates confidentiality and professionalism. Changing results is unethical and falsifies the record. Diagnosis is outside the medical assistant's scope of practice. Question 34. Before the visit continues in a phlebotomy station, a patient reports feeling dizzy after standing quickly. Which immediate action reduces fall risk? Option A. Assist the patient to sit or lie down safely. Option B. Leave the patient standing while searching for forms. Option C. Ask the patient to walk faster. Option D. Tell the patient dizziness is impossible. The correct answer is option A. Assist the patient to sit or lie down safely. Helping the patient into a safe position reduces the chance of injury from fainting or falling. An unsteady patient should not be left unsupported. Walking can increase fall risk when the patient is dizzy. Dismissing symptoms does not protect patient safety. Question 35. Given the workflow in a busy front office, the date of birth in the chart does not match the date of birth stated by the patient. Which response best protects patient safety? Option A. Stop and resolve the discrepancy before proceeding with care. Option B. Use the appointment time as the identifier. Option C. Correct the date of birth without asking anyone. Option D. Continue if the last name matches. The correct answer is option A. Stop and resolve the discrepancy before proceeding with care. A mismatch in identifiers must be clarified before treatment, specimen collection, or documentation continues. Appointment times are scheduling data and are not approved identifiers. Changing demographic data without verification may create a documentation error. A last name alone does not rule out an identity error. Question 36. When a patient encounter unfolds in a patient education session, a fax containing patient information must be sent to another facility. Which step reduces privacy risk? Option A. Verify the recipient fax number before sending. Option B. Send it to a number from memory without checking. Option C. Include unrelated patient charts in the same fax. Option D. Leave the fax confirmation on a public counter. The correct answer is option A. Verify the recipient fax number before sending. Verifying the destination helps prevent disclosure to the wrong recipient. Memory errors can lead to misdirected protected information. Only necessary information should be disclosed. Confirmation pages may contain protected information and should be handled securely. Question 37. Given the workflow in a medication administration visit, office supplies are consistently running out before the next order date. Which administrative action is best? Option A. Wait until every item is completely gone. Option B. Hide supplies from the provider. Option C. Order random supplies without reviewing use. Option D. Track usage and adjust par levels according to office needs. The correct answer is option D. Track usage and adjust par levels according to office needs. Inventory control uses usage patterns and reorder points to prevent shortages. Waiting can interrupt patient care and office workflow. Hiding supplies does not solve inventory management. Unplanned ordering can waste money and storage space. Question 38. While working in a pediatric clinic, a patient needs crutch walking education after provider instruction. Which principle is important? Option A. Crutches should be used only on wet floors. Option B. The patient should skip follow-up if pain increases. Option C. Body weight should rest mainly on the armpits. Option D. Crutches should fit properly and not press into the axilla. The correct answer is option D. Crutches should fit properly and not press into the axilla. Improper crutch fit can compress nerves and blood vessels in the axilla. Crutches are mobility aids and wet floors increase fall risk. Worsening symptoms should be reported according to instructions. Weight should be supported through the hands, not the axilla. Question 39. Given the workflow in a procedure setup, the assistant must clean instruments before sterilization. Which concept explains this requirement? Option A. Packaging instruments makes cleaning unnecessary. Option B. Organic material can interfere with sterilization. Option C. Disinfection always destroys every spore. Option D. Sterilization is the same as hand washing. The correct answer is option B. Organic material can interfere with sterilization. Cleaning removes debris so the sterilization process can contact instrument surfaces effectively. Packaging dirty instruments traps contamination rather than preparing them safely. Disinfection reduces many organisms but does not reliably destroy all spores. Hand washing reduces microbes on skin but is not instrument sterilization. Question 40. To protect safety in a family practice clinic, a tickler file is used in the office. Which purpose does it serve? Option A. Measure oxygen saturation. Option B. Track future follow-ups or reminders. Option C. Draw blood into tubes. Option D. Sterilize instruments. The correct answer is option B. Track future follow-ups or reminders. A tickler system helps staff remember time-sensitive tasks or future actions. Oxygen saturation requires a pulse oximeter. Blood collection uses phlebotomy supplies, not a reminder file. Sterilization requires approved equipment and process. Question 41. At the start of care in a walk-in clinic, a pulmonary function test is scheduled. Which patient instruction may be relevant according to protocol? Option A. Wear tight clothing that restricts breathing. Option B. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Option C. Ignore all provider instructions about inhalers. Option D. Eat a heavy meal immediately before every test. The correct answer is option B. Follow pre-test directions about inhalers, smoking, and effort during breathing maneuvers. Pulmonary testing depends on patient preparation and proper effort during the test. Restrictive clothing can interfere with respiratory effort. Medication instructions should follow the provider or testing protocol. A heavy meal may interfere with comfortable breathing for some tests. Question 42. At the start of care in a same-day appointment, a patient says they cannot afford a prescribed medication. Which response is best? Option A. Tell the patient to stop all medications. Option B. Notify the provider or appropriate staff so alternatives can be discussed. Option C. Suggest sharing medication with a friend. Option D. Ignore the comment because finances are private. The correct answer is option B. Notify the provider or appropriate staff so alternatives can be discussed. Cost concerns affect adherence and should be routed to the care team for appropriate options. Stopping medication without provider guidance can be unsafe. Sharing prescriptions is unsafe and inappropriate. The concern directly affects care and should be addressed respectfully. Question 43. As part of exam preparation in an internal medicine office, a coworker posts a patient's unusual injury story on social media without a name but with enough details to identify the patient. Which issue is most concerning? Option A. Quality control testing. Option B. Routine scheduling. Option C. Breach of confidentiality. Option D. Appropriate marketing. The correct answer is option C. Breach of confidentiality. Identifiable health details can violate privacy even if the patient's name is omitted. Quality control relates to test system accuracy, not social media disclosure. Scheduling does not involve posting private health information publicly. Using patient information for entertainment or marketing requires strict authorization and is not appropriate here. Question 44. Following office protocol in a telephone triage workflow, the assistant is comparing two needle gauges. Which statement is accurate? Option A. A larger gauge number always means a longer needle. Option B. A smaller gauge number indicates a larger needle diameter. Option C. All injections use the same gauge. Option D. Gauge has no relation to needle size. The correct answer is option B. A smaller gauge number indicates a larger needle diameter. Needle gauge numbers are inverse to diameter, so lower numbers are wider. Gauge describes diameter, not length. Needle gauge varies by medication, route, and patient factors. Gauge specifically describes needle diameter. Question 45. The care team in a patient education session asks for guidance because a capillary puncture is needed on an adult finger. Which side is generally preferred? Option A. The side of the middle or ring finger pad. Option B. The center of the thumb pad. Option C. The little finger near the bone. Option D. The tip of the index finger. The correct answer is option A. The side of the middle or ring finger pad. The lateral side of the middle or ring finger pad helps avoid bone and sensitive central tissue. The thumb is often calloused and has a pulse, making it less preferred. The little finger has less tissue over bone and is usually avoided. The index finger is commonly used for touch and may be more sensitive or calloused. Question 46. Given the workflow in a diagnostic testing area, the assistant speaks with a patient who has hearing difficulty. Which approach is best? Option A. Assume the patient cannot participate. Option B. Shout from another room. Option C. Cover the mouth while speaking. Option D. Face the patient and speak clearly at a moderate pace. The correct answer is option D. Face the patient and speak clearly at a moderate pace. Facing the patient supports lip reading and clear communication without shouting. Hearing difficulty does not mean the patient cannot understand or decide. Shouting from a distance reduces clarity and privacy. Covering the mouth removes visual cues. Question 47. The care team in an exam room asks for guidance because a vial contains 100 mg per milliliter and the order is 50 mg. Which volume should be prepared? Option A, 0.5 milliliter. Option B, 1 milliliter. Option C, 10 milliliters. Option D, 5 milliliters. The correct answer is option A, 0.5 milliliter. Dividing the ordered dose by the available concentration gives 50 divided by 100, which equals 0.5 milliliter. 1 milliliter would provide 100 milligrams. 10 milliliters would provide 1000 milligrams and is far above the ordered dose. 5 milliliters would provide 500 milligrams at this concentration. Question 48. For a patient encounter in a preventive care visit, coordination of benefits is needed. Which situation does this usually involve? Option A. A patient needs a sterile dressing. Option B. A patient has more than one insurance plan. Option C. A patient has one cash payment only. Option D. A provider orders a throat swab. The correct answer is option B. A patient has more than one insurance plan. Coordination of benefits determines how multiple plans share payment responsibility. Dressing supplies do not create coordination of benefits by themselves. One cash payment does not require multiple plan coordination. A throat swab order does not itself involve multiple insurance plans. Question 49. Before the visit continues in an electronic health record review, a medical office uses a policy and procedure manual. Which purpose is most accurate? Option A, replace all state laws. Option B, guarantee every claim is paid. Option C, provide standardized guidance for office tasks. Option D, eliminate the need for training. The correct answer is option C, provide standardized guidance for office tasks. Policies and procedures help staff perform tasks consistently and safely. Office policy cannot override applicable law. Policies do not guarantee pay or reimbursement. Policies support but do not replace staff training. Question 50. To protect safety in an administrative check-in area, a patient calls with chest pain and shortness of breath. Which scheduling action is most appropriate? Option A, tell the patient to send an email later. Option B, follow emergency triage protocol immediately. Option C, schedule the patient for next month. Option D, give a diagnosis over the phone. The correct answer is option B, follow emergency triage protocol immediately. Potential emergency symptoms should be handled urgently according to office protocol rather than scheduled as routine. Potential emergencies require immediate action. Routine scheduling can delay care for potentially serious symptoms. Medical assistants should not diagnose the cause of symptoms. Question 51. The care team in a phlebotomy station asks for guidance because the medical assistant is measuring respirations after counting the pulse. Which technique helps obtain the most accurate result? Option A, count respirations while the patient is unaware of the measurement. Option B, count for 5 seconds and multiply by 12. Option C, record the respiratory rate from the last visit. Option D, ask the patient to breathe as deeply as possible. The correct answer is option A, count respirations while the patient is unaware of the measurement. Patients may change breathing patterns if they know respirations are being counted. Very short counts are often inaccurate for respirations. Current respirations must be measured during the encounter. Deep breathing changes the normal respiratory rate and effort. Question 52. After reviewing the situation in a family practice clinic, a patient arrives for a routine visit and appears anxious about the first blood pressure reading. Which communication technique should the medical assistant use? Option A, ignore the anxiety to avoid making it worse. Option B, acknowledge the concern and explain the procedure in simple terms. Option C, promise that the provider will not be concerned. Option D, tell the patient the reading is probably wrong. The correct answer is option B, acknowledge the concern and explain the procedure in simple terms. Acknowledging emotion and explaining the task supports trust while keeping the patient informed. Ignoring patient concerns can increase anxiety and weaken communication. Promising an outcome goes beyond the assistant role and may be inaccurate. Dismissing the result can reduce confidence and may be clinically misleading. Question 53. The care team in an outpatient laboratory asks for guidance because a disinfectant label lists a 10-minute wet contact time. Which action is necessary? Option A, use the disinfectant only on clean hands. Option B, wipe the surface dry immediately. Option C, keep the surface wet for the full listed contact time. Option D, dilute the solution more to reduce odor. The correct answer is option C, keep the surface wet for the full listed contact time. Disinfectants need the manufacturer's required contact time to achieve the intended level of microbial kill. Environmental disinfectants are not hand hygiene products. Removing the disinfectant too soon can make it ineffective. Unapproved dilution can reduce disinfectant strength. Question 54. A medical assistant is working in a community health clinic when a complete blood count is ordered. Which tube is most commonly used? Option A, light blue tube with sodium citrate. Option B, gray tube with fluoride oxalate. Option C, lavender tube with EDTA. Option D, red tube with no anticoagulant. The correct answer is option C, lavender tube with EDTA. A complete blood count requires anticoagulated whole blood, and EDTA in a lavender tube preserves cell morphology. Sodium citrate is used mainly for coagulation studies. Gray tubes are used for tests such as glucose or lactate depending on protocol. A red tube allows clotting and is not the standard choice for a complete blood count. Question 55. After reviewing the situation in a telephone triage workflow, a patient requests an appointment reminder by text message. Which consideration is important? Option A, ignore all reminder preferences. Option B, text any diagnosis to any phone number in the chart. Option C, post the reminder on social media. Option D, follow office policy and patient communication preferences. The correct answer is option D, follow office policy and patient communication preferences. Electronic reminders should follow privacy policy and documented preferences. Preferences help guide appropriate communication. Sensitive information and wrong numbers can create privacy risk. Public posting would expose private information. Question 56. During an administrative check-in area, a 12-lead electrocardiogram shows wandering baseline artifact. Which cause is most likely? Option A, correct limb lead placement. Option B, a normal calibration mark only. Option C, poor electrode contact or patient movement. Option D, a properly grounded machine with still patient. The correct answer is option C, poor electrode contact or patient movement. Wandering baseline is commonly caused by motion, loose electrodes, or poor skin contact. Correct placement should reduce rather than create artifact. Calibration marks do not explain baseline movement during tracing. Good grounding and stillness reduce electrical or motion artifact. Question 57. As part of exam preparation in a same-day appointment, a package of sterile instruments has an expired sterilization date under office policy. Which action is appropriate? Option A, open the package and rinse the instruments. Option B, reprocess the instruments before use. Option C, write a new date on the package. Option D, use the instruments if the package is dry. The correct answer is option B, reprocess the instruments before use. Expired or compromised sterile items should not be used until they are properly reprocessed. Rinsing does not restore sterility. Changing the date without reprocessing is unsafe and misleading. A dry package alone does not override an expiration policy. Question 58. The care team in a cardiology practice asks for guidance because a patient appears to be choking but can cough forcefully. Which response is generally appropriate? Option A, encourage coughing and monitor closely. Option B, leave the patient alone until they stop coughing. Option C, perform blind finger sweeps immediately. Option D, give the patient food to push it down. The correct answer is option A, encourage coughing and monitor closely. A forceful cough suggests partial airway obstruction, and coughing may clear it. The patient should be monitored because the obstruction may worsen. Blind finger sweeps can push the object deeper and are not appropriate. Food can worsen the obstruction. Question 59. While working in an urgent care office, the prefix hyper appears in a term such as hyperglycemia. Which meaning is correct? Option A, between. Option B, around. Option C, below normal. Option D, above normal or excessive. The correct answer is option D, above normal or excessive. Hyper means excessive or above normal, as in high blood glucose. Between is indicated by inter. Around is indicated by peri. Below normal is indicated by hypo. Question 60. Before the visit continues in a walk-in clinic, a patient asks for a copy of their medical record. Which action should the assistant take? Option A. Delete sensitive information before the request is reviewed. Option B. Refuse because records belong only to the provider. Option C. Follow the office release of information process. Option D. Give the record to anyone who asks. The correct answer is option C. Follow the office release of information process. Patients generally have rights to access their records, but the request must follow proper identity and release procedures. Altering the record is inappropriate and may violate legal requirements. Patients have rights to access their health information under applicable rules. Identity and authorization must be verified before disclosure. Question 61. When a patient encounter unfolds in an outpatient laboratory, the assistant scans a signed consent form into the wrong patient's chart. Which action is best? Option A. Ask the patient to sign a blank form. Option B. Leave it because both patients use the same clinic. Option C. Report and correct the filing error according to policy. Option D. Delete the form and tell no one. The correct answer is option C. Report and correct the filing error according to policy. Misfiled records can affect patient care and privacy, so they must be corrected properly. Blank forms do not correct the misfiled record and are inappropriate. Clinic use does not make one patient's document appropriate in another chart. Unreported deletion can worsen the documentation error. Question 62. To protect safety in a patient intake station, a patient falls in the exam room. Which action is best? Option A. Tell the patient to drive home without evaluation. Option B. Hide the incident if no one saw it. Option C. Call for help and assess for injury before moving the patient. Option D. Pull the patient up immediately. The correct answer is option C. Call for help and assess for injury before moving the patient. After a fall, unnecessary movement can worsen injury, so help and assessment come first. The patient should be assessed before leaving. Falls must be reported and documented according to policy. Moving the patient before assessment can worsen an injury. Question 63. For a patient encounter in a certification exam scenario, a medical assistant prepares to administer an injection. Which set best represents medication rights? Option A. Right diagnosis only. Option B. Right insurance, right copay, right appointment, and right room. Option C. Right patient, right medication, right dose, right route, right time, and right documentation. Option D. Right color of vial and right storage shelf. The correct answer is option C. Right patient, right medication, right dose, right route, right time, and right documentation. The medication rights are safety checks used to prevent administration errors. Diagnosis alone is not enough to confirm safe administration. Administrative details do not replace medication safety checks. Vial appearance and shelf location are not sufficient medication rights. Question 64. An office review in a preventive care visit shows that a payer sends money with a remittance advice. What does the remittance advice explain? Option A. Where to place EKG chest leads. Option B. Which vaccine lot is expired. Option C. How to sterilize forceps. Option D. How the claim was processed and paid or denied. The correct answer is option D. How the claim was processed and paid or denied. Remittance advice provides payment, denial, adjustment, and reason information for claims. Electrocardiogram placement is unrelated to insurance remittance. Vaccine inventory is not the purpose of remittance advice. Sterilization instructions are not part of remittance advice. Question 65. For a patient encounter in a treatment room, a patient needs assistance transferring from a wheelchair to the exam table. Which action is safest? Option A. Leave the wheelchair unlocked for easier movement. Option B. Ask the patient to jump to the table. Option C. Pull the patient by the arms quickly. Option D. Lock the wheelchair and use proper body mechanics with assistance as needed. The correct answer is option D. Lock the wheelchair and use proper body mechanics with assistance as needed. Locking equipment and using safe transfer technique reduces injury risk for the patient and staff. An unlocked wheelchair can roll and cause a fall. Jumping is unsafe and unrealistic for a transfer. Pulling can injure the patient and the assistant. Question 66. After reviewing the situation in a same-day appointment, a claim is denied because patient insurance information was outdated. Which front office process helps prevent this issue? Option A. Code every visit as preventive care. Option B. Verify insurance eligibility at each visit according to policy. Option C. Use the oldest card in the file without asking. Option D. Skip registration for returning patients forever. The correct answer is option B. Verify insurance eligibility at each visit according to policy. Eligibility verification helps identify coverage changes before claims are submitted. Coding must reflect the service and documentation. Old cards may no longer reflect active coverage. Returning patients can have changed insurance or contact information. Question 67. After reviewing the situation in a patient education session, a patient wants information released to a spouse. Which documentation is usually needed? Option A. No documentation because spouses always have full access. Option B. A note written by the assistant after the fact. Option C. A valid authorization or permission according to office policy. Option D. A verbal request from the spouse only. The correct answer is option C. A valid authorization or permission according to office policy. Disclosure to another person should follow privacy rules and documented patient permission. Relationship alone does not automatically grant full access to records. Authorization should come from the patient or legal authority. The spouse's request alone may not authorize release. Question 68. For a patient encounter in a cardiology practice, a claim requires the code for an office visit procedure or service. Which code set is used? Option A. ICD-10-CM. Option B. Zip code. Option C. Policy number. Option D. CPT. The correct answer is option D. CPT. CPT codes describe medical procedures and professional services. ICD-10-CM codes describe diagnoses and reasons for services. A zip code identifies location and is not a procedure code. A policy number identifies insurance coverage and does not describe the service. Question 69. As part of exam preparation in a medical office workflow, the suffix ectomy appears in a procedure term. Which meaning is most accurate? Option A. Abnormal softening. Option B. Surgical removal. Option C. Visual examination. Option D. Inflammation. The correct answer is option B. Surgical removal. Ectomy means surgical removal of a structure. Abnormal softening is indicated by malacia. Visual examination is often indicated by scopy. Inflammation is indicated by itis. Question 70. Following office protocol in an outpatient laboratory, blood spills on an exam room floor. Which response follows standard safety practice? Option A. Cover the spill with an exam table paper. Option B. Ask a patient to avoid stepping on it. Option C. Use appropriate personal protective equipment and an approved disinfectant. Option D. Wipe the spill with a dry paper towel only. The correct answer is option C. Use appropriate personal protective equipment and an approved disinfectant. Blood spills require barrier protection and a disinfectant suitable for bloodborne pathogen cleanup. Covering a spill does not remove or disinfect the hazard. Patients should not be involved in hazardous cleanup. Dry wiping can spread contamination and does not disinfect the surface. Question 71. To protect safety in a family practice clinic, the assistant is exposed to a needle stick from a used needle. Which action should occur first? Option A. Finish all remaining patients before telling anyone. Option B. Place a bandage on the site and ignore it. Option C. Hide the incident if there is no bleeding. Option D. Wash the area and report the exposure according to protocol. The correct answer is option D. Wash the area and report the exposure according to protocol. Immediate cleansing and prompt reporting start the exposure management process. Delaying reporting can delay needed evaluation and follow-up. Covering the wound alone does not address exposure risk. A needle stick can transmit bloodborne pathogens even with minimal visible injury. Question 72. For a patient encounter in a busy front office, a patient is placed lying face down for a back examination. Which position is being used? Option A. Supine. Option B. Fowler. Option C. Prone. Option D. Lithotomy. The correct answer is option C, prone. Prone means lying on the abdomen with the face downward. Supine means lying on the back. Fowler is a seated or semi-seated position. Lithotomy involves legs in stirrups for certain pelvic procedures. Question 73. When a patient encounter unfolds in a women's health clinic, a pregnancy test performed in the office is classified as wave testing. Which requirement still applies? Option A, skip controls because waved means unregulated. Option B, report results before the test develops. Option C, use expired kits if the package is unopened. Option D, follow manufacturer instructions and quality control policy. The correct answer is option D, follow manufacturer instructions and quality control policy. Wave tests are simple, but they still require correct procedure, controls, and documentation. Waived status does not eliminate quality responsibilities. Reading before the correct time can produce inaccurate results. Expired test kits may give unreliable results. Question 74. In an electronic health record review, a patient with diabetes is scheduled for fasting laboratory work. Which action is appropriate? Option A, cancel the test because diabetes always prevents fasting labs. Option B, tell the patient to stop all diabetes medications without provider input. Option C, tell the patient fasting means no restrictions at all. Option D, review fasting instructions and route medication questions to the provider. The correct answer is option D, review fasting instructions and route medication questions to the provider. Fasting instructions can be reinforced, while medication adjustments require provider guidance. Diabetes requires careful instructions but does not automatically cancel testing. Medication changes can be unsafe without provider direction. Fasting usually includes specific limits on food and drink. Question 75. As part of exam preparation in a preventive care visit, the assistant identifies an abnormal rhythm on a tracing after it prints. Which action is within the medical assistant role? Option A, give the tracing to the provider promptly according to protocol. Option B, diagnose the rhythm for the patient. Option C, discard the tracing to avoid alarming the patient. Option D, change the tracing to make it look normal. The correct answer is option A, give the tracing to the provider promptly according to protocol. The assistant may recognize urgency and route the tracing, but interpretation belongs to qualified clinicians. Medical assistants should not provide a cardiac diagnosis. Abnormal results must not be hidden or discarded. Altering medical records is unethical and unsafe. Question 76. While working in an administrative check-in area, a medication is labeled for otic use. Where should it be administered? Option A, nose. Option B, eye. Option C, ear. Option D, mouth. The correct answer is option C, ear. Otic medications are intended for the ear. Nasal medications are administered through the nose. Eye medications are ophthalmic, not otic. Oral medications are taken by mouth. Question 77. At the start of care in a walk-in clinic, a staff member shares an electronic health record password to save time. Which risk is created? Option A, better sterilization monitoring. Option B, automatic insurance approval. Option C, improved privacy protection. Option D, loss of accountability for chart access. The correct answer is option D, loss of accountability for chart access. Unique logins support audit trails and show who accessed or changed information. Login credentials do not sterilize instruments. Passwords do not control payer authorization. Password sharing weakens privacy and security. Question 78. For a patient encounter in a clinical skills review, a 24-hour urine collection begins at 8 a.m. Which instruction is correct? Option A, leave the container unrefrigerated unless it smells unusual. Option B, discard the first void and collect all urine for the next 24 hours. Option C, keep only the first void and discard the rest. Option D, collect urine only when symptoms occur. The correct answer is option B, discard the first void and collect all urine for the next 24 hours. Discarding the first void establishes the start time, and all urine afterward is collected until the end time. Storage requirements should follow the test protocol and preservative instructions. A single first void is not a 24-hour collection. Timed urine testing requires all urine during the collection period. Question 79. During a patient intake station, A patient is ready for venipuncture and the labels have already printed. Which identification step should be completed before collecting the specimen? Option A. Ask a family member to confirm the name only. Option B. Ask the patient to state 2 identifiers and compare them with the order. Option C. Label the tube after returning to the lab. Option D. Use the room number because it is faster. The correct answer is option B. Ask the patient to state 2 identifiers and compare them with the order. Using 2 approved identifiers before collection helps ensure the right test is performed on the right patient. A family member may be mistaken and 1 identifier is not enough for positive identification. Delayed labeling increases the risk of specimen mix-ups and rejected samples. A room number can change and is not considered a reliable patient identifier. Question 80. The care team in a telephone triage workflow asks for guidance because a patient must pay a percentage of the allowed charge after the deductible is met. Which term applies? Option A. Remittance address. Option B. Coinsurance. Option C. Copayment. Option D. Referral. The correct answer is option B. Coinsurance. Coinsurance is the patient's percentage share of covered costs. A remittance address tells where payments or documents are sent. A copayment is usually a fixed amount rather than a percentage. A referral is permission or direction to see another provider. Question 81. A medical assistant is working in a primary care office when a patient asks which body system includes the skin. Which system should be identified? Option A. Respiratory system. Option B. Urinary system. Option C. Endocrine system. Option D. Integumentary system. The correct answer is option D. Integumentary system. The integumentary system includes the skin, hair, nails, and related glands. The respiratory system supports breathing and gas exchange. The urinary system filters blood and eliminates urine. The endocrine system is made of hormone-producing glands. Question 82. Following office protocol in a women's health clinic, the provider is running behind and a patient asks for an update. Which response is professional? Option A. Apologize for the delay and provide the best available estimate. Option B. Discuss another patient's emergency as the reason. Option C. Guarantee an exact time even when it is unknown. Option D. Tell the patient that waiting is their only option. The correct answer is option A. Apologize for the delay and provide the best available estimate. Clear and courteous updates help manage expectations without blaming others. Sharing another patient's situation can violate privacy. False certainty can create more frustration. Dismissive communication is unprofessional. Question 83. At the start of care in a patient education session, the office schedules several patients at the start of each hour and sees them as rooms open. Which scheduling method is being used? Option A. Wave scheduling. Option B. Matrix blocking. Option C. Prior authorization. Option D. Stream scheduling. The correct answer is option A. Wave scheduling. Wave scheduling brings patients in at set intervals such as the start of an hour. Matrix blocking reserves time unavailable for patient appointments. Prior authorization is payer approval and is not a scheduling method. Stream scheduling assigns patients specific individual appointment times. Question 84. When a patient encounter unfolds in a clinical skills review, the provider asks for the chief complaint before entering the room. Which documentation is most appropriate? Option A. Write your normal after exam. Option B. Ear infection diagnosed today. Option C. Patient seems dramatic about ear pain. Option D. Patient reports sharp right ear pain for 2 days. The correct answer is option D. Patient reports sharp right ear pain for 2 days. The chief complaint should be documented as the patient's main reason for the visit in clear, concise wording. Exam findings belong to the provider and are not the chief complaint. A diagnosis should not be documented by the assistant unless the provider has made it. Subjective judgment is unprofessional and not appropriate for the medical record. Question 85. An office review in a medical office workflow shows that a peak flow test is ordered. Which body system is being assessed? Option A. Urinary system. Option B. Skeletal system only. Option C. Integumentary system. Option D. Respiratory system. The correct answer is option D. Respiratory system. Peak flow measures how quickly air can be exhaled and is related to respiratory function. The urinary system is assessed with urine tests and related procedures. Peak flow does not measure bone structure. The integumentary system involves the skin, hair, and nails. Question 86. As part of exam preparation in an outpatient laboratory, a patient says they feel chest pressure while the electrocardiogram is being prepared. Which action should the medical assistant take? Option A. Tell the patient it is probably anxiety. Option B. Complete all paperwork before telling anyone. Option C. Notify the provider immediately and follow emergency protocol. Option D. Ask the patient to drive to another clinic. The correct answer is option C. Notify the provider immediately and follow emergency protocol. Chest pressure may indicate a serious condition and requires prompt clinical attention. Medical assistants should not diagnose the cause of chest pressure. Administrative tasks should not delay reporting possible cardiac symptoms. Potential cardiac symptoms should be handled through established emergency procedures. Question 87. Before the visit continues in a specialty referral visit, a patient is crying after receiving difficult news from the provider. Which nonverbal behavior is supportive? Option A. Sit at eye level and allow silence when appropriate. Option B. Laugh to lighten the mood immediately. Option C. Keep checking messages during the conversation. Option D. Stand over the patient with crossed arms. The correct answer is option A. Sit at eye level and allow silence when appropriate. Calm presence, appropriate eye level, and respectful silence can support a distressed patient. Humor can be inappropriate when a patient is distressed. Distracted behavior suggests the patient is not being heard. Closed posture and standing over the patient can seem intimidating. Question 88. A medical assistant is working in a same-day appointment when a patient asks for a diagnosis based on symptoms described during intake. Which response is appropriate? Option A. Ignore the symptoms because they are subjective. Option B. Give a diagnosis to save time. Option C. Document the symptoms and tell the patient the provider will evaluate them. Option D. Tell the patient to search the internet for a diagnosis. The correct answer is option C. Document the symptoms and tell the patient the provider will evaluate them. Medical assistants collect information and support workflow, while diagnosis is the provider's responsibility. Reported symptoms are relevant and should be documented. Diagnosing is outside the medical assistant scope. Unguided self-diagnosis can be inaccurate and unsafe. Question 89. When a patient encounter unfolds in an exam room, a reagent bottle is past its expiration date. Which action is appropriate? Option A. Change the expiration date on the label. Option B. Use it only for abnormal patients. Option C. Mix it with a new reagent to strengthen it. Option D. Do not use it for patient testing. The correct answer is option D. Do not use it for patient testing. Expired reagents can produce inaccurate results and should be handled according to policy. Altering dates is unsafe and unethical. Expired reagents are not reliable for any patient testing. Mixing reagents without approval can invalidate testing. Question 90. A medical assistant is working in a women's health clinic when a specimen label is missing after collection. Which action is best? Option A. Write a name on the tube from memory. Option B. Follow facility policy for recollection or correction without guessing. Option C. Ask another patient if the tube belongs to them. Option D. Send the tube with no label and explain later. The correct answer is option B. Follow facility policy for recollection or correction without guessing. Unlabeled specimens create patient identification risk and must be managed according to policy. Guessing can cause a serious misidentification error. Patients cannot resolve specimen identity errors reliably. Laboratories commonly reject unlabeled specimens. Question 91. To protect safety in a primary care office, a medical assistant leaves a computer screen open with patient information visible. Which safeguard would help prevent this issue? Option A. Disable audit trails to speed workflow. Option B. Lock the workstation before stepping away. Option C. Keep the screen facing the waiting room. Option D. Share passwords with trusted co-workers. The correct answer is option B. Lock the workstation before stepping away. Locking the workstation protects electronic protected health information from unauthorized viewing. Audit trails support security monitoring and should not be disabled by staff. Visible screens increase privacy risk. Shared passwords weaken accountability and violate security practices. Question 92. During a pediatric clinic, A coworker asks to view a neighbor's chart out of curiosity. Which response is appropriate? Option A, share the chart because staff work in the same clinic. Option B, deny the request because there is no job-related need to know. Option C, print the chart and remove the patient's name only. Option D, open the chart if the coworker promises not to tell anyone. The correct answer is option B. Deny the request because there is no job-related need to know. Access to protected health information must be limited to legitimate work-related purposes. Employment at the same clinic does not automatically authorize chart access. De-identified information must meet specific standards and curiosity is not permitted access. A promise does not create a permitted reason for access. Question 93. To protect safety in a patient education session, the provider asks for body mass index during an adult wellness visit. Which values are needed? Option A, pulse and respirations. Option B, oxygen saturation and pain score. Option C, blood pressure and temperature. Option D, height and weight. The correct answer is option D, height and weight. Body mass index is calculated from height and weight. Pulse and respirations are vital signs but are not used to calculate body mass index. Oxygen saturation and pain score provide different clinical information. Blood pressure and temperature do not determine body mass index. Question 94. At the start of care in a pediatric clinic, the assistant needs to keep provider meeting time unavailable for patient appointments. Which scheduling tool is useful? Option A, coinsurance posting. Option B, matrix blocking. Option C, sterile field setup. Option D, order of draw. The correct answer is option B, matrix blocking. Matrix blocking reserves time in the schedule for meetings, procedures, or other unavailable periods. Coinsurance posting relates to patient financial responsibility. Sterile field setup supports clinical procedures, not schedule blocking. Order of draw guides blood collection sequence. Question 95. For a patient encounter in a certification exam scenario, a pulse oximeter is placed on a cold finger and the reading is inconsistent. Which action should be tried first? Option A, warm the finger or choose a better perfused site. Option B, increase oxygen without reporting the finding. Option C, place the probe over wet nail polish. Option D, ignore the waveform and record the lowest value. The correct answer is option A, warm the finger or choose a better perfused site. Poor peripheral perfusion can make pulse oximetry readings unreliable. Medication or oxygen changes should follow provider direction and clinical protocol. Moisture and polish can interfere with sensor performance. An unstable signal should be corrected before documenting the value. Question 96. During a telephone triage workflow, a minor arrives without a parent for a non-urgent visit. Which action is best? Option A, ask another patient in the waiting room to consent. Option B, assume all minors can consent to every service. Option C, follow state law and office policy for consent requirements. Option D, refuse all care without considering exceptions. The correct answer is option C, follow state law and office policy for consent requirements. Consent rules for minors vary by situation and jurisdiction, so policy must be followed. Other patients cannot provide consent for the minor. Minor consent is not universal for all services. Some laws allow minors to consent for certain services. Question 97. A medical assistant is working in a primary care office when the term tachypnea appears on an intake form. Which meaning is correct? Option A, rapid breathing. Option B, painful urination. Option C, low temperature. Option D, slow pulse. The correct answer is option A, rapid breathing. Tachy means fast, and nea relates to breathing. Painful urination is dysuria. Low temperature is hypothermia. Slow pulse is bradycardia. Question 98. The care team in a clinical skills review asks for guidance because a patient arrives at check-in and the waiting room can overhear the conversation. Which practice protects privacy? Option A, state the full diagnosis loudly to confirm the visit. Option B, ask other patients to help verify the record. Option C, speak quietly and avoid announcing sensitive details. Option D, place all charts open on the counter. The correct answer is option C, speak quietly and avoid announcing sensitive details. Front office privacy requires limiting unnecessary disclosure where others may overhear. Announcing diagnoses in public can violate confidentiality. Other patients should not be involved in private verification. Open charts may expose protected information. Question 99. A medical assistant is working in a clinical skills review when a subpoena for medical records arrives at the office. Which response is best? Option A. Ask the receptionist to summarize the chart from memory. Option B. Give it to the provider or designated privacy officer for proper handling. Option C. Ignore it because subpoenas never apply to clinics. Option D. Immediately fax the entire chart without review. The correct answer is option B. Give it to the provider or designated privacy officer for proper handling. Legal requests for records should be reviewed through office policy before information is released. Summaries from memory are unreliable and not an appropriate legal response. Subpoenas can require action and should not be ignored. Records should not be released without verifying legal requirements and scope. Question 100. Following office protocol in a certification exam scenario, a small fire starts in a trash can at the clinic. Which acronym guides the initial fire response? Option A. RACE. Option B. SOAP. Option C. PRN. Option D. NPO. The correct answer is option A. RACE. RACE stands for Rescue, Alarm, Contain, and Extinguish or Evacuate depending on policy. SOAP is a documentation format and does not guide fire response. PRN means is needed and does not guide emergency fire response. NPO means nothing by mouth and is unrelated to fire safety.